I came from a small community where there was not a lot of healthcare access. I just saw the effects of people not having healthcare and what that did. And so I just found my calling as I grew up in life and knowing that it's always best to help other people. One Community Health is a federally qualified health center in Sacramento.
We provide primary care and specialty care to our community patients.
When I started at One Community Health, I was seeing that we were having a higher spend in things like reference lab, things like translation interpretation services.
We engaged with ERA, and since then, they helped us identify some of the areas where we had a lot of potential savings.
Our firm works with clients to help them optimize the cost of all the goods and services they buy. So with One Community Health, we've looked at things like their pharmacy delivery costs. We've looked at language translation services. We've looked at medical supplies, dental supplies, office supplies, telecommunications costs. It's really a wide variety of goods and services where we have experts that we can bring alongside to help the client optimize that cost area.
I was actually nervous about ERA coming in because I thought that I was going to have to invest a lot of my time with them. They would not know a lot about the organization and what our needs are, but that wasn't the case. My time involvement was very minimal.
But we always try to make sure that we don't take a lot of client time. We do need a little bit of help grabbing some accounting data. We always want to interview their expert in whatever that area is so that our teammate can meet with them and find out what's important to them about service and delivery. But once we've done that, we try to stay in the background and only engage with them when there's a report to review or some findings we need to go over with them.
Really, the benefit of working with ERA is that because it's on a contingency basis, it's like, why not?
Our fee comes from the savings we drive for the client. If the project doesn't produce savings that we can track, that are material to the client and that they're happy with the new vendor, then we don't get paid.
We have realized hundreds of thousands of dollars of savings in the 2+ years that we've been working with them. Savings that are now going back into our workforce.
We've been able to use those savings in other areas to provide better healthcare and services to our patients. It makes me feel proud. I've always been very passionate about nonprofit, and I think that's one of the reasons that I love working here is because we give so much back to the community.
There's people at need, and myself and my teams have the talent to help people and to bring them a better quality of life.
We really like healthcare, especially community health, because we can see a direct result for the work that we do. If we reduce costs, the healthcare center can then take those dollars and reinvest it into outreach, upgrading equipment, upgrading facilities, and we really see a benefit to the community of the work that we do with the health center.